Abstinence versus harm reduction. It's the principal argument at the heart of every controversy over substance use. For decades, public health officials and progressive politicians fought tooth and nail against those who preached abstinence as the only solution. Progressives won the battle and advanced the more humane policy of harm reduction, which nobody fought harder for than the people of San Francisco.
Cell by cell, the virus destroys its carrier's immune system. Untreated, the person becomes ill from a series of infections that are progressively serious and rare, and finally fatal. This is AIDS.
In the early 1980s, HIV, the virus that causes AIDS, began infecting disproportionately gay men and injection drug users concentrated in New York and San Francisco.
The fear was everywhere in the city. At San Francisco General, more and more gay men, like Bobby Reynolds, were confronting the hard fact of being diagnosed with the deadly new disease. It was an opportunistic infection, like others the physicians would see, taking advantage of a weakened immune system.
Often by the time they came into the hospital, they could only say 2 or 3 words in succession without needing to take a breath.
Combined with the stigma and isolation that a lot of patients had to endure, made it not just a terrible death physically, but a terrible death in every other way as well.
There were 3 men who were dying with pneumocystis carotis pneumonia, and they were not gay men. They were injecting drug users. The shooting gallery is a place where people would come in and rent a needle and syringe, finish using the drugs, return the needle and syringe, and it would be rented to the next person and the next person. And you could not construct a social system that was better designed to transmit a blood-borne disease.
AIDS presented a mortal threat, and for cities like San Francisco, abstinence was neither a practical nor socially acceptable solution. Pressuring people to stop having sex or eradicating injection drug use were simply unrealistic strategies that would ultimately hurt, not help, in the war against AIDS. Harm reduction proved to be the best hope. At the core of the harm reduction strategy is the belief that when fighting a public health crisis, a premium should be placed on minimizing harmful effects rather than simply ignoring or condemning them. But at the time, this approach met with great resistance. Progressives from San Francisco and around the country fought in the courts, Congress, and with public opinion to secure harm reduction as a tool to fight AIDS. They won the right to widely distribute condoms, safe sex education, and to protect the identities of those testing for HIV. For injection drug users, the fight was over free needle exchange, a battle that was won in San Francisco, yet still rages in many cities across America today. Joining us today to talk more about San Francisco's storied history with harm reduction and how that legacy may now be in jeopardy is Damon Jacobs, practicing psychotherapist and associate fellow at the R Street Institute, where he specializes in tobacco harm reduction and harm reduction approaches to sexual behavior. Jacobs was also a strong voice in support of vaping at the June 14th public hearing in San Francisco, where the Board of Supervisors, led by Malia Cohen, heard testimony on the proposed ordinance to ban flavors in e-juice.
When I moved here in 1990, that was really the time when HIV and AIDS was hitting my community the hardest. And the Board of Supervisors responded to the epidemic in many ways, one of which was helping with needle exchange, providing safe syringes for people who were using IV drugs to reduce new HIV infections. It wasn't saying that drug use was good or cool or healthy. It was saying if somebody is already using drugs and they can't quit and they want to reduce the harm, that needle exchange was a tool for doing that. So now today I'm standing here opposed to the ordinance you are proposing, and the reason is because e-cigarettes is included in there as a tobacco product. E-cigarettes are not tobacco products, and if we're talking about policy based on science, I ask you to look at the science. I don't want any adult or child to ever start using nicotine, but if they are going to use nicotine, and if an adult has tried and used many attempts to quit and been unable to, I believe they deserve opportunities to use tools tools for harm reduction, just like we have done in San Francisco with needle exchange, with PrEP, with so many other ways that San Francisco has stood as the leader of harm reduction.
Damon, thanks again for joining us on RegWatch. You made quite the speech there at the Board of Supervisors. What's your reaction to the fact that they ended up passing the ban on e-juice flavors?
Yeah, not cool. Brandon, it's disappointing. It's heartbreaking, again, to see the city that I love turn its back on harm reduction and to disregard these empirically based tools.
So, Damon, you obviously see vaping then as a tool for harm reduction.
I see it that way, but I don't think they see it that way. I think for them, banning the sale of flavored tobacco products and including vaping products in that definition, for them, I think they are considering that as doing something. And unfortunately to me, they're not following medicine, they're following morality. They're following dogma, not data. And that's the part that is disappointing for me, is that the usually scientifically based, rational policies that the board has implemented are not being implemented now.
Damon, the board's decision to ban flavored e-juice smacks of hypocrisy, considering how strongly progressive politicians in San Francisco have supported harm reduction in the past.
So something is amiss there, and the best explanation I can ever try to get about where this discrepancy is happening has to do with the perception of fighting back against tobacco companies. And that when these legislators, who again have promoted harm reduction in the past but are against it in this case, it seems to be something that they think they're doing or they're posturing about doing, that we have to fight big tobacco. But of course, as you and I have discussed, they're not really fighting against big tobacco because they're not trying to eliminate the sale of actual tobacco cigarettes. That's where I would really love to have a conversation with Malia and the board, who are voting in ways that I think really are contradictory to their history.
Damon, when Supervisor Malia Cohen introduced the flavor ban, it was touted as a way to protect people in the LGBT community from getting hooked on flavored tobacco.
So I sent you 2 leaks from the CDC website. One that said that HIV-related deaths in the U.S. are now down to 12,333 every year. Now that's still way too high, but that's much, much lower than it used to be. At the height of the epidemic, it was about 50,000 a year. Okay, then at the same time, the CDC reports that LGBT-related smoking deaths are at 30,000, more than double that of HIV. So why do we have this discrepancy in the LGBT community where we have done so much good work to manage and reduce the impact of HIV and AIDS and reduce new infections so significantly? And that's great, but we're totally ignoring or disregarding these incredibly high numbers of GLBT people that are dying from smoking every year. We're not talking about it. We're not having parades, petitions, or protests about it.
Damon, you make an impassioned point, but opponents to vaping appeal to passion too. Specifically, they argue bans are needed to protect the children.
Well, there's already laws and regulations that protect the youth from smoking in the first place in California. And if you can't enforce those laws, that has nothing to do with vaping. I'm talking about protecting adults who have already started and want to quit. But it's that same argument that was used against condoms 30 years ago. You have to protect the kids. You have to protect the kids. Well, what about the lives of the adults? Where do those come into play? And why do Americans think that it's either or? Protecting kids and protecting adults is not an either or dichotomy. It's both and. You can do both at the same time.
Final question, Damon. It's been said politics is everything in San Francisco, and considering how far the city and the state leans left, do you feel betrayed by this decision?
You ask me, like, if I personally feel betrayed? I feel very disappointed in what people who claim to be left or to be Democrats or to claim to be compassionate, I feel very, very disappointed with how this has played out. Something is amiss, and it's troubling and it's sad. And as someone, again, who loves San Francisco and is on, usually on the left, it's really disturbing to see these contradictions.
Well, that's it for this edition of RegWatch. Before you head off, please like us on Facebook and don't forget to follow us on Twitter. For RegulatorWatch.com, I'm Brett Stafford.